Here is a program that you can do while laying down. All the exercises are laying down, and it's a great program to do in the morning before you get up out of bed to get the circulation going. It's a great program to do if you get home from work and your back's a little sore and tight because you've been sitting all day or standing all day, or maybe you just got back in from a walk and things are feeling tight. It's a great program to do then too. And right before you go to bed, if you're typically one of those sleepers that have to toss and turn to try to get comfortable, doing this program right before bed can loosen things up enough to help you have a peaceful night's sleep. So for all those reasons and any other time you want to do it, this 10-minute program gently stretches out everything of your lower back and even has some strengthening components to help your core. So I hope this helps. And here we go. Let's get started. Grab one of your legs with both your hands and pull it up towards your chest. Single knee to chest. Now, if your knee doesn't like to bend this far, or if your hands are having a problem, I'll talk you through some variations. We're looking to hold this for 20 seconds. And if your knee doesn't want to bend that much, you don't have to put your hands in that position. You can grab behind your shin, kind of more underneath, in between the fold of your knee, and just pull on the thigh. That way it won't compress your knee. That can give you a better feeling up there. We're looking for the stretch, though, of course, to be underneath your hip and up towards your back. There's that alternate hand position. Also, you could take a belt or a pillowcase or a sheet or something like that and use that to kind of hook your leg and pull it up that way. In case your arms aren't long enough for your flexibility, you can grab behind that. And then if your hands don't like to grip that sheet or towel or belt, you can loop it around your hands. So you actually don't have to squeeze to hold it. It'll just pull up with your hands. So each leg, alternate sides, 10 seconds to 20 seconds. And you can pull it up however far you need to get that stretch. And back off if you're getting any kind of pain. You definitely want to avoid any pinching type of pain in your groin area in the front. But we are looking for a nice moderate, medium stretch along your butt and your back. The next exercise is a double knee to chest. So similarly, you're going to feel this stretch on your butt and your back. But we want to do it now with both legs to raise it up a notch. As you pull your knees up, you don't want to pull them up both at the same time. See how I'm do one leg and then one leg. There you go. Because if you lift up both at the same time or lower both of your legs down at the same time, it puts in a tremendous strain on your back, causing your back to arch up and giving you some pain. So do one leg at a time. You can have your hands behind your knees like that, or you can have them over top of your shin, whichever seems to be more comfortable for your knees. It gives you better leverage for the stretch. Your knees should stay either close together as you pull them up, or if you need to, just open them wider, and that gives a little bit of different kind of stretch feeling for your back. 20 seconds, couple times. And then we'll move on to the hamstring stretch. The hamstring stretch, similar to the single knee to chest stretch, you want to grab behind one leg. But this time, instead of just pulling that knee up as far as you can, you're now trying to straighten your leg up as far as you can. So your foot's going up towards the ceiling. Your hands are staying in that position behind your knee. And adjust either how far you pull your thigh up, but most importantly, it's about how straight your leg can get. There it is, nice straight leg. You should feel this stretch maybe a little bit in your back, around your butt, down your hamstring, that muscle along the back of your thigh, and even into your calf. To ramp it up a little bit, to give a little stronger stretch, and if you can do this, I would suggest you do it, straighten out the leg that's on the bed, because that will give you a stronger stretch across the hips, because it causes it to rotate a little bit. You might even feel a stretch along the front of your thigh of that leg that's on the ground. Primarily, though, we're looking for the hamstring stretch along the back of the thigh of the leg that you've got up in the air. Hold it 20 seconds. You can still use that belt or towel or something too if you don't want your hands to have to do all the work right there. And you can even add a component where you draw your toes closer down towards your face. Watch my foot here. Yeah, so if you pull it that way, it'll intensify the stretch in the lower part of your leg or in that calf. Nice all around lower leg stretch, lower body stretch, the whole leg stretch. We'll go into trunk rotations next. This stretches for like the side of your hips and your back. This is a dynamic stretch because we're moving, we're doing repetitions back and forth, rather than like the static stretching we were just doing where you held the position for a bit. With this stretch, you keep your feet up as close to your body as you can, but it's fine if they need to be further out than where my feet are demonstrating. And then your knees stay together and you let your knees tip over to the side as far as they can go until you feel a nice stretch along the side of your hip, maybe all the way down to your knee and up to your shoulder blades if it's really tight and stretching it out. Just go as far as you can. Don't force through pain, but you do want to be able to get yourself to feel a stretch. You're also getting a little bit of an abdominal workout here as you're using your oblique muscles and your ab muscles there to kind of pull your legs up and out of the position and across your body. So that's a bonus. As you get warmed up doing this stretch, there's a slightly more aggressive stretch for the same muscles where you add some overpressure. This exercise is called the Piriformis Stretch. The piriformis muscle is one of the muscles in your butt cheek. There's the glutes and there's the piriformis. It's a triangle-shaped muscle and the sciatic nerve passes through it. And so if you're getting any kind of sciatic type symptoms, tingling or numbness down into your leg, this exercise could help. This is also going to loosen up any sore tight muscles in your butt or your back. So I've got my opposite hand to the opposite knee, and your foot can stay there along that side of the thigh, or if you think you've got more flexibility, move your foot in front of the other leg. And then if you've even got more stretch, go ahead and let your back rotate up over so that it twists your back as well as pulls on your hip muscles. My other hand swings up so that it's out flat there, and that keeps my shoulders flat and my head down onto the bed. You definitely want to keep your shoulders and your head down and just let the whole mid back, lower back, and hip get all the benefit of the stretch. Your foot can rest on top of the leg, or you can bring that foot to the front of your leg, and you can feel that stretch now on the left hip. 20 seconds. Breathing. Sometimes I can feel as I'm doing this stretch, I'll feel it stretching in my hip first, and then as I take some breaths and really let it relax, I'll feel it stretching up further into my lower back too. It's a good feeling. Both sides, 20 seconds twice. Next, we'll move on to a little bit of core strengthening. We'll start off with an isometric exercise for the abs. Isometric strengthening means that you're not moving, though you're getting stronger while you're holding a position with tension. And to do this exercise, while you're laying on your back with your knees bent, suck in your stomach. As you suck in your stomach, it should make your back go flat against the bed. See how my hips rolled up a little bit like that? That's good. That's called a pelvic tilt. And that would be great for engaging that muscle and to protecting your back by keeping it straight. 5-second contractions. Make sure you're breathing, which means you might want to count out loud. At least if you're counting, that means you're breathing, which is making sure that you're not holding your breath. The diaphragm muscle controls your breathing. That's not your abdominal muscle. This transverse ab is a little bit lower. It's situated between your hip bones below your belly button, and it's just like a belt-shaped muscle. And that's the one that really helps to stabilize your spine and your hips. So something as simple as rolling over in bed, if that gives you pain, if you use this muscle, sucking in your stomach, it'll help protect your back. Definitely want to be using that muscle too if you're doing any kind of lifting exercise. Now I'm doing a marching variation, and by lifting your legs up, you're creating some asymmetry that challenges your abdominal muscles even more. So your foot doesn't have to go up very high, just a little bit off the bed. It's not about stretching your hips, just about creating that asymmetry, that imbalance. Keep your stomach sucked in this whole time. Stomach is isometrically contracted. You're still breathing, but one leg up and then alternate to the other 10 times each leg. The next variation here, I call this the toe taps. When both legs are suspended off the ground, it really challenges your abs. Only do this if you feel like you can do it without pain, and very importantly, that you can keep your back flat. If you feel your back arching up, then this variation isn't for you just yet. Ultimately, for good back health, you will want to be able to do this exercise, but you have to do it safely or you'll be setting yourself back. Stomach is still super duper sucked in, back is flat against the bed, and your feet come up alternately like that to the toe taps. Moving on to the bridging. The bridge exercise is for the glute muscles. It helps stabilize your core and your SI joint. There's a rolling motion, so you're not just lifting your butt up in the air. It's purposeful. And the first thing you do is you suck in your stomach, and then pelvic tilt, and your butt rolls up off the bed first. Then your lower back comes off the bed, and then your ribs. On the way down, it's the exact opposite. First the ribs to go down, and then your back, and then your butt. You really want to kind of curl and cave your body in so it makes that motion purposefully. Also, your knees should stay hip width apart. A lot of times as that muscle gets tired, the glute medius muscle that we're really trying to work here for the best stabilization, if that muscle fatigues, your glute muscles will try to help out, which means your knees will fall open a bit. Look down at your knees and make sure they're only as wide as your hips. And that's how far away your feet should be from each other as well. Okay. I hope that hit the spot for you and provided your body with a chance to feel better. You can also check out my lower body sitting program, the upper body program, and an all-inclusive full body warm-up that I call head to toe, get up and go. Take care of your body. It will always pay you back.